I decided to become a nurse practitioner after experiencing my father through his congenital heart disease. He had 3 open heart surgeries now. A couple of them were when I was in high school and college. So they were done at the Mayo Clinic, and I was able to actually kind of see him through the process from the pre-op all the way through surgery, ICU, and his recovery home and with cardiac rehab as well. The most rewarding part of my job is seeing patients who are sick and ill coming into the clinic and being treated, whether it's with testing and figuring out what's wrong, or medications, interventions, and seeing them thrive and return back to a normal life and feeling better. My patient care philosophy, I try to take care of the patient as a whole, including any family members. If the patient is elderly, I try to make sure that if they're at a facility, that they have communication back on their care, their child is involved in their care, any children involved in their care, and then also just making sure there's good communication between myself and the patient on, follow-up on test results, and what the plan's going to be, so that way they feel that they're informed and they know the plan of action and then are involved in their care as well. One word to describe me is, I would say, empathetic. I feel like sometimes some of the patients, they hit home to me. I have a very good relationship with a lot of my patients, and I see them very often, and a lot of times kind of know their story, their families, and sometimes see multiple patients in one family. And so it's kind of a little bit of a taking care of everybody, in the family as a whole. One thing that's interesting about me, I'd probably say that I'm a little bit of an introvert and a little bit shy. I don't kind of come off that way because I feel like it can just being in this role as in healthcare, you have to have lots of conversations with patients and their families, and so I'm very open with that way, but typically I'm very introverted and like to kind of keep quiet, keep to my small little family and my small group of friends, and enjoy that quiet time. After a patient has a visit with me, I hope that they understand more about their diagnosis and kind of truly have an understanding of their plan of care and know what the next step is going to be, and don't feel uncertain after their visit.